The reason premiers are getting away with pointless bans, cruel bans, is that they and their advisors have terrified the public into thinking they need them, or we'll all die. But one of the things that struck me from the start, as you know, is how wildly exaggerated some of the expert modelling has been. The World Health Organization started it, claiming that 3.4% of people with the virus would die. 3.4, completely wrong. And then there was the modelling from Britain's Imperial College that shocked the world. Claims that even with social distancing and many more intensive care beds, around 250,000 people would die in Britain alone, and more than 1 million in America. In Australia, the same sort of wild modelling. Australian National University experts in March warned that at least 21,000 Australians would be killed by the virus, whatever we did. And one of the Morrison government's deputy chief medical officers said it would be even higher than that. Between 50,000 and 150,000 of us would die of this virus. The death toll so far, under 800 people. And that's even after the catastrophic bungling of the Victorian government. That's even after adding sick people who died with the virus to those who died of it. Now, one of the biggest fake scares was also reported in the Medical Journal of Australia in March, claiming that we'd run out of intensive care beds by April 5. Completely run out of them. The government's chief medical officer himself warned that we face what he called an horrendous scenario, a daily demand of intensive care beds of 35,000 a day plus. And that started that mad scramble we saw to free up more hospital beds. People needing elective surgery banned. Remember that? Governments also spent millions of dollars on creating more intensive care beds. 7,000 we've got now, but how many of those 7,000 beds are actually used today by people with this virus? 29. What went so wrong? Well, joining me is Emma McBryde. She's a professor of infectious diseases modelling at James Cook University. Professor McBryde, thank you so much for your time. How did this happen?
Thank you for having me. Well, the early models that were put together, of course, had to make some simple assumptions. We didn't know a lot about the virus. A number of people did models in the early days that looked at what would happen if we did absolutely nothing, not a single individual making any effort to avoid the virus at all. And so, of course, the predictions were pretty grim. But on top of that, the modelling that was being provided to the government had an error in it that made it threefold, 300% higher than even that grim picture that many models had been showing.
Well, take us through the predictions that would run out of intensive care beds, that 35,000 people a day would need them. That obviously caused a lot of mayhem, a lot of suffering. A lot of people who wanted elective surgery couldn't have it. A lot of surgeons and hospitals were then left empty with patients that never came. How did that happen?
All right, so what happened was a number of people did some models, and in my group found that that figure would be something more like 10,000. ICU beds. It's still a lot,
yes.
But the Doherty group that was advising the government put that number at more in the 30,000 mark. And so my group was really confused by this. Why is their figure so much different from ours? A member of my group looked at the paper and found that it was internally inconsistent. It must have an error in it. They've done something with their code. We contacted the group and said, look, we think you've got hospitalisation and ICU mixed up. They agreed, they were 300% out. They were threefold too high. The numbers that were coming out were pretty high anyway, but this was 3 times higher than that. And they agreed that this was an error. It was a simple coding error. They would correct the public record and ensure that was put to bed.
Calling out a scare never makes the person who was right very popular. How has the reaction been to what you did?
I'm not in a communication bubble at the moment, let's put it that way. I'm
well, at least you won't get the virus.
That's right.
Professor
I was just
McBryde,
thinking, I probably would rather have my left arm have been removed today than what's happened today. It's
honestly,
not a good place.
This is just, I tell you what, I can't believe some of the things I'm seeing here. Professor McBryde, obviously, we're not downplaying the virus. The virus is serious. People are dying from it. That bit, no one's disputing that. But then the way we've reacted to it, the scale and the broad catch-all kind of bans, etc., has that been an overreaction?
Look, I think what we need to do from the start is follow the evidence of what works. And what works is isolating cases that are known to have COVID. That's something that didn't always happen. Then what works is quarantining cases that might have COVID. You know, if they have maybe a 1 in 10 to 1 in 100 chance of having COVID. For the general public, the broad things that are known to work, the evidence is there, is physical distancing, good hand hygiene, not touching your face. And then halfway through the pandemic, we realised that actually wearing a mask was very, very effective as a broad measure if you're in a hotspot. All the other measures, I don't think there's sufficient evidence for. So curfews, never seen any evidence that says that curfews work. You know, telling people they can't sit outside in an outdoor place for some fresh air, I can't think of a single bit of evidence that supports that. So I think what we have to do is follow the evidence and then be enormously proportional in the response based on the risk of the person. If someone's got a 1 in 100,000 chance of having coronavirus, they should be allowed to go about their business as long as they're doing the right physical distancing and so forth.
Professor McBryde, this was just so obvious for so long, but I'm afraid that you've now joined the club of people who will be called granny killers. It's been done on the ABC. I admire your courage for putting up your hand for this punishment, but thank you so much for being evidence-driven. It's so rare.
Absolutely. But let's protect the elderly. That's the strategy. That's what we need to be focusing on.
But of course, I mean, why is something so simple now so radical? I mean, it's just terrible. Professor McBryde, I really appreciate you coming on the show. Thank you so much indeed. And if you need any tips on how to survive being hated, you've come to the right man. I'll talk to you off.
All right, I'll learn fast. Thank you very much. Cheers.
See you
Bye-bye.
later.
See you.
Australia Today.